Hey, come over here. Hey, the ambulance is over here. Come on. We're trying to get you help, bud. Go over and see the girls in the ambulance. Come on. Come on. Go see the girls in the ambulance. They're going to get you the help. They just want to check your vitals. That's all they're going to do. Come on. That's all they're going to check your vitals. Make sure everything's okay. Have a seat. Have a seat.
You have to talk to us. All right? What's your name? You speak English? Hey. Hey.
That's all of it again. 1 minute he's head up, eyes up, looking around. Next minute head down.
Give me some light of me. Get ready to wake up. Or do you want me to have the pleasure? Pop it. Breathe that in.
You don't want it up your nose and talk to me. Stop acting stupid. You're a grown man. Tell me, open your mouth and talk to me. While they're out here on the interstate with you. Hello? Hello? I'm not playing. What's your name?
All right, so check this out. Can you please tell us your name so you can take this out your nose? I know it stinks. We know it stinks. Come on, partner.
It's just your name.
You don't want to say it in front of the police officer?
You want to write your name down? Can you write your name?
If it's an act, it's a pretty good act.
Yeah.
Because I see the same thing when I see a variety of drugs being used.
Yeah.
Now, if you're taking something, we're not here to judge you.
What you been
You're going to
taking?
get treatment. If you're taking anything, we're going to get treatment for it.
What you been taking?
Well, supposedly he was naked on top of the cab of a tractor.
I just want to go ahead to the substation and go to sleep. So if you tell me your name, we'll let you go so I can go back to bed.
She's being serious.
I'm being fucking serious. I'm sleepy. Give me a damn name so I can go home, for real. I'm tired.
Sit here, okay?
Please give me your name so I can go home. I know you know what the hell we're talking about because you're sitting there laughing and
What's your
bullshitting.
name?
So tell us your damn name, please. Do you want to go home? Or do you want to go to the hospital? Or do you want to go to jail?
Okay, if you don't want to go to the hospital, you can go with me. Those are your choices.
Talking in about the next 5 minutes.
You're going to be less than that, because I've been playing this game for far too long. I've been very patient with you.
What are you looking at me for? You full of shit, bro.
Yeah, he is. Yeah, he is.
You don't want to talk to us? Yes or no? We know you can talk. We know you can understand us. No, you got to be real with us. What is your
Shake
name?
your head, or if you do,
Okay.
you don't.
Do you want to go to the hospital? Yes or no? Do you want to go to jail?
Well, those are your two
Then
choices.
come on, I'm going to give you a ride. You don't want to go to the hospital, Leos? Let's go. His vitals are good, ladies?
Yes.
All right, I'm going to give you a ride. Do not walk on the interstate. Walk right on the shoulder road. You're not going to jail. You're not under arrest. I'm going to give you a ride. I ain't giving you a ride to jail, because if I was going to give you a ride to jail, you'd be in handcuffs. You're not in handcuffs. You're not under arrest. I'll figure out where you live. Give you a ride to a safe environment. That's all I want. I want to make sure you're all right.
Let's talk about what we just witnessed. No way around it. That video is horrifying to watch. Every time I see it, I wish I could just stop the video. It's it is so grossly negligent that I don't even know where to begin in addressing it. But I do want to point out a couple things from it. One of the things that you notice in this video is that the providers had a preconceived notion that this was nothing more than someone who is consciously making decisions not to communicate with them. But they overlooked a lot of big red flags that should have told them that this patient is not of sound mind. For example, what did the officer say the patient was found doing when all of this situation started? Dancing naked on top of a tractor. Not exactly normal behavior. They seemed to think that he was making a conscious decision not to talk to them. And it was really frustrating them. They never seemed to consider the fact that he could not understand what they were saying to him. And they used some things that they saw as evidence for his ability to understand. For example, you notice the one provider mentioned, "Oh, you know exactly what I'm saying because you're smiling and laughing." So take a look at that for a second. If you watch the video very closely, you see that that individual is grinning, but only when he's looking in the face of a provider who is also smiling. It's not uncommon for a person with schizophrenia or some other psychiatric illness to do what is often referred to as mirroring. They just kind of instinctually mimic what they see someone else doing. And that seems to be the case with this particular patient. Another instance was where you saw the one paramedic saying, "Do you want to go to jail or the hospital?" And she's like, "Do you want to go to the hospital or do you want to go to jail?" You know, doing this thing with the head nodding and shaking. And while he's watching her, you see kind of this hesitant reaction where he once again is mirroring what that paramedic is doing, but that doesn't necessarily mean that he comprehended what she was saying. This was tunnel vision to the worst extent. The providers just had decided that they were not going to perceive this patient as having anything less than full capacity, and they paid the price for it. My question to you is, would you have recognized the signs that this was a patient who lacked capacity? And also, do you think there was enough evidence there that you could document to support a decision to transport the patient against his will? I think there's more than enough.